Hello, my name is Kath. I'm a children's nurse by background and I work at NHS England improving experiences of care, importantly for and with people. I'm really excited by this suite of films and supporting ebook resource that has been developed with people who have autism. It'll help guide us as healthcare professionals about how we meet the needs of people with autism in the best way possible. Our actions can make all the difference, whether it be ensuring that we have the right communication skills, ensuring that we consider environmental factors, whether it's about the timing and how we engage with people. There's information for us all here. Please do share the films, have conversations with colleagues. Together we can make sure that people with autism have much better healthcare experiences. Thank you.
All right, ready?
Yeah.
Okay, well, I'll come with you.
No, you don't have to. We've been through this, man.
Okay, right, well, don't forget your medical note and your autism alert card.
I know I was going to get them. I was going to, get out the coins.
All right, fine. No?
Yes.
No?
Yes. Leave it, ma'am.
Fine.
Can I help? It's not letting me in. It won't recognise you if you're late for your appointment. I'm not late. You'll have to check in here. What's your name, please? Hannah. Okay, I can see you, Hannah. You're booked in with the healthcare assistant. You just want to take a seat. Thank you.
My appointment's 10 minutes late.
She's running a little late. She'll be with you shortly.
I know, but I came in at the right time and I did everything right and I did all the things and yeah, I came in at the right time. And
If you're unable to wait, you can call back and rebook
I
the
don't want
appointment.
to do that. I don't want to call back. Why would I
can.
want to take a seat? The seats are there. They're meant to be there. I'm not gonna lift it up and walk out.
Look, it's not right to speak to me this way. If you don't speak to me in a reasonable manner, I'll call the police.
Stop it. Don't call the police. You don't need the police call. Just stop it.
Okay, you ready?
Yeah.
Mind if I come with you?
Yeah. Sure, if
Okay.
it makes sense.
All right, don't forget your medical note and your autism alert card. Okay, I think we can leave those there, don't you? Yeah.
Fine.
All right. Hannah, your notes.
Oh, yeah, sorry.
Hi there.
Hi.
How can I help today?
Sorry.
No problem.
I'm Hannah Denwood.
Hi there.
I've got an appointment at 1:30 p.m.
Okay, let's see if I can find you on the system here. Oh yes, is it with the healthcare assistant?
Yeah.
Yeah, okay, thank you. I've let her know that you've arrived.
I've got.
Thank you, Hannah. Okay. Would you like me to see if there's a quiet place for you to sit?
Yes, please.
Yeah. But for next time, if you let us know ahead, and we can make it a longer appointment for you, and then we can put it either at the start of the day, at the end of the day, it might make it a bit better for you.
Oh, yeah.
Is that okay?
That'll be cool.
Okay, I'll just go and see what I can find for you.
Thank you.
Hannah, please.
Hiya.
Hiya Hannah, I believe you're here for a blood test?
Yeah.
Yeah, okay.
I do have an autism alert card.
Oh right,
Is
okay.
that
Yeah,
okay?
no problem. Fabulous, thank you very much, I'll give you that back.
Yeah. How are you going to do the procedure?
Okay, so when I do the procedure, I'll put a little pillow under your arm, keep your arm nice and straight for me. Okay, and then I'll pop a tourniquet around your arm, which will tighten your arm a little bit at the top. I'll swab your arm just a little bit. I'll pop the needle in, take the blood, take the tourniquet off, and then just a little bit of cotton wool. Okay, and then a plaster. Okay, is that okay for you?
Yeah, no amazing with needles.
Oh, you don't like needles? Okay, that's fine. No, but you're fine to look away, that's okay. You lift your sleeve up, that's perfect, thank you. Okay, I'm just going to feel for a vein, all right? Okay, that's fine. Right, you just feel a little scratch, all right? Okay, and that's it done.
Okay.
Just put your finger on there for me and press really, really hard for me. That's it, no problem. And you're not allergic to micropore or plasters?
No.
Nope. There we go. All done.
I would ask the receptionist for a longer appointment because I have autism and it would take me a long time to explain what is wrong with me. I need to see the same doctor every time I go to the surgery because he knows my problems. I would like to sit in a quiet room and then they could come and get me when it is my appointment. I feel impatient if I had to wait so long and feel upset. It is difficult to talk to the doctor as I get struggled for words, so the doctor needs to speak slowly.
Giving me priority reduces the amount of time that I have to wait and can lessen my anxiety levels.
Giving me appointments in the middle of the day, say 2:30 in the afternoon, that's quite stressful for a person with autism. Maybe giving me the appointment at 1st in the morning or maybe last before you close, that would really help with just the stress levels. Also maybe giving me longer periods. I know a lot of the time that's not possible, but just possibly wherever possible. Also maybe just give me someone that I'm familiar with, someone that isn't a stranger, because people with autism are not really big fans of meeting new people and strangers in an official environment like that.
Hello everyone, my name is David Gill and I'm a Learning Disability and Autism Advisor at NHS England. As I have a diagnosis of autism, I related to, that film and what happened. Making those reasonable adjustments is important For example, the mother giving the daughter the chance to, you know, make a choice whether she wanted her to come, you know, and support her or not was important, because it makes you feel like you're not being treated like a child. It makes you feel like you're in control of that situation. Also, having those reasonable adjustments in a doctor's setting or any setting is important, as it helps the person to get the right support that they need to get the service they need. This is also important to be transferred in an A&E setting, so every child or young person can get the right care and support at the right place, at the right time, by the right person. I hope you enjoyed this film and that the information in this film will help your clinical practice on a day-to-day basis.
Hiya, what's your emergency?
My daughter's been up all night, she's been vomiting, she's got a really high temperature.
Right, how old, what age is she?
She's 8 now.
Right, I'm just going to take her name and date of birth down and I'll get you through to see somebody straight away. What's her name?
It's Georgia Wilson.
Yeah.
And it's 1st of November 2017.
Right, that's great. If you just want to go and take a seat, somebody will be with you soon. Okay. Sorry. Hiya, what's your emergency? Sir, what's your emergency?
It's not really an emergency per se.
So what's up?
Well, it's my stomach. It hurts quite a lot. You see.
Right. Then why have you come to A&E?
Well, it's the pain. You know.
Right. Have you tried to make an appointment with your GP?
No, I haven't been able to make an appointment with
right,
the GP.
I would insist that you do make an appointment.
But it's my stomach really does hurt, and it really hurts a lot. I need, because I can't make an appointment because it just doesn't, you know, in the machine things.
Right.
Machine.
Right. Fine. Right. What I'll need to do is just take your name and your
Okay.
date of birth, okay? And then you'll have to go and wait over there on the seats, but you're going to have a very long wait as we're really busy.
Yes, thank you though. That's fine. That's
right.
fine.
Can I just take your name?
My name is Ben Longbourn.
Yeah. And your date of birth?
It's the 20th of the 4th, 2000.
That's fine. If you just want to go and take a seat across.
Thank you very much.
Okay.
Ben Longbourn.
Sorry.
Just have a seat, please. Hi Ben, I'm Mike. I'm one of the A&E doctors. How can I help you today?
I've got a pain in my stomach mainly.
Okay. And how long have you had this pain for?
Well, I've had pains in my stomach since I was about 12, but you know I haven't had it that long. But this one has been for most of the day mainly.
Okay, and have you taken any medication to control the pain at all?
The medication isn't very effective, I don't think.
What medication have you tried?
I'm not sure of the exact name.
Okay, is it prescribed by a doctor for a condition?
It is prescribed by my GP.
Okay. Are you passing any blood when you open your bowels?
No, I haven't. I don't think so. I mean, you know, I don't check, but.
And are you moving your bowels every day?
Well, I think so.
Okay. Are you passing water? Okay. You're going to the toilet, all right?
I'm not sure, but I would think so. Otherwise, I guess I would have noticed probably.
Okay, fine. When did you last have some pain medication?
I guess this morning.
Okay, fine. Did you think of going to maybe a GP to discuss today?
I wasn't able to go to my GP.
Right.
I did try to go to my GP.
Okay, well, I don't necessarily think that A&E is the right place for you today, Ben. So what I'll do, I'll give you some medication to try and help you get on top of the pain, but I really think that this is something that you need to go back to your GP for and discuss.
Discuss with the GP.
A&E is not the place for this presentation, I'm afraid. So
yeah.
just check, you're not allergic to anything?
No.
Okay, I'll just go and have a chat with the nurse, get you some medication.
Okay,
and
thank
just
you,
make an
I'm
appointment with
sorry.
your GP the next time you're
Yeah.
here, alright?
Sorry.
Okay.
Thank you.
Hiya, what's your emergency?
My daughter's been vomiting all night. She's got a really high temperature.
And how old is she? Right, yeah, I'm just going to have to take her name and date of birth, and then I'll get you straight through to see a paediatric doctor. Okay, what's her name? Yeah. Yeah, and the date of birth. Right, great. If you just go and take a seat.
Next emergency, please. I have IBS and I suffer from hypersensitivity, and this means I'm in extreme pain at the moment. I don't have my medication isn't very effective at the moment, and this means that I'm in constant pain as well. Thank you, sir, but we'll have to take your name and your date of birth before a doctor can see you. My name is Benjamin Longbourn, and I was born on the 10th of the 4th, 2000. Thank you, sir. A doctor will see you soon. Thank you.
Hiya, what's your emergency?
I have IBS and hypersensitivity, and the pain is unbearable, and my medication isn't having much effect, and I'm in lots of pain.
Right, this isn't really an emergency. Have you tried to make an appointment with your GP?
I've tried to, but I have a.
Oh, what's this? Let's have a little look. Right, okay, I've got details on here. Let me just input these and I'll get somebody to put you through.
Thank
okay,
you.
all right, I'll give you this back.
Thank
Just
you.
go and take a seat. Okay.
Okay, thank you.
Ben Longbourn, please.
Yes.
Hello, Ben. Come in,
Hello.
have a seat for me.
Thank you.
Hi, Ben. I'm Mike. I'm one of the A&E doctors. How are you doing?
I'm doing fine, thank you.
Okay, what's brought you in today?
Well, it's mainly I have stabbing pains in my stomach, and I suffer from IBS and also hypersensitivity, so it's heightening the pains.
Okay. And is the hypersensitivity part of your autism, is that right?
I think they're connected.
Okay,
Yes.
fine. And how long have you had IBS for?
Since I was about 12.
Okay. And are you currently on medication for that?
Yes.
Yeah, you are. And do you see your GP to manage that, or do you see a specialist in the hospital?
I don't see a specialist, and I used to see my GP more regularly, but I know I just mainly see them for renewing prescriptions and checking that it's still effective.
Fine. Is there any reason why you don't go more frequently to the GP?
I find it stressful to book appointments.
Okay.
Because I don't like the answering machine. If there isn't someone in the, and sometimes also even if there is someone in the hospital, I get confused and I'm not very clear about what I want,
Okay.
so it can be difficult to book appointments.
Okay, fine. And do you think that sort of anxiety regarding that, anxieties regarding other issues that potentially make your IBS worse?
Yeah, if I'm in a stressful situation, like I'm late for something, or there's lots of noise, or if there's something scheduled and it doesn't happen, I can sometimes make the pain worse. I think it feels that way, certainly. Like stress kind of adds to the pain.
Okay. And have you ever discussed ways with your doctor about controlling the anxiety?
Not in detail.
Okay, fine. Just in terms of the pain, do you have any other symptoms at all? Are you going to the toilet more often than normal? Or?
Yeah, I seem to have a runny stomach. I don't eat very much. I kind of get a bloated feeling, which affects my eating. So even if I'm hungry sometimes,
Okay. And again, do you think that the anxiety that you suffered makes that element and those symptoms worse?
I guess so. I would say so, yeah.
Okay, fine. Well, I think from looking at your observations, they're all within normal limits, which I kind of expected, Ben. I suspect that there's a lot more than just IBS here. I think that it's anxiety that is making your condition worse.
Yeah.
And so I think controlling the anxiety will hopefully control the IBS better than just putting you on lots of medication.
Yeah.
So what I would propose we do is, because things are stable, is I will write to your doctor and I will ask him to make a time that's suitable for you to come in and see him, to sit down and discuss how you could deal with the anxiety side of things to try and control the IBS symptoms better. It may be that there are things such as counselling,
Yeah.
alternative treatments that may be run by a local IBS specialist that we could use to try and control your symptoms better than anything that I can do here in the A&E department. Because all I could really give you was pain medication, which I don't think is going to be necessarily the answer. And I think it's dealing with the anxiety side of things that's probably going to improve your care and your health better than anything else.
Okay.
Would you agree with that?
No, that seems, yeah, that seems fine. Thank you.
So as part of my discharge letter, I'll write to your doctor to say that we've met today, had this discussion, and I'll ask him to make sure he contacts you with an appropriate time, either by phone or by post, for which you can then go in and see him and have a discussion. Would that be okay?
So it's a set appointment?
Yeah.
Yeah, okay.
Would
Thank
that be
you.
fine?
That would be very good.
Okay,
Thank
great.
you.
Well, you take care.
Thank
All
you.
the best, and we'll see you later. All
Thank
right.
you very much.
The use of a health passport would be helpful to me, so that it can cut out communication issues and it would make me feel like I'm not repeating myself all the time.
When I'm in the middle of an appointment, you can't really explain to me what is wrong by explaining loads of technical jargon, abbreviations, and in this day and age, internet slang. When you're talking to me, in my personal experience, because every autism is different, in my personal experience, just try and speak more slowly. Just try and make it easy to understand, simple, basic English. Don't cover it with loads of technical jargon. Thank you.